Thanks for joining me for this brief discussion about what hypertension is, how it can affect you, and ways you can work towards improving your health through lifestyle changes. Additionally, we will explore what anxiety is and how anxiety can contribute to hypertension, and ways we can work at reducing anxiety and in turn, better manage our blood pressure. Well, what exactly is hypertension? Hypertension is the temporary or sustained elevation of systolic or diastolic blood pressure. Blood pressure is the result of cardiac output and total peripheral resistance, meaning the force of blood being pumped by the heart and the resistance this force is met with inside the arteries. Someone is considered hypertensive when their systolic blood pressure is above 139 and their diastolic blood pressure is above 89. Systolic blood pressure results when blood is ejected into the arteries from the heart and is the top number on your blood pressure reading. Diastolic blood pressure pertains to the pressure your blood exerts within the arteries between heartbeats and is indicated by the bottom number of your blood pressure reading. So for example, if you have a blood pressure reading of 120/80, 120 would be your systolic blood pressure and 80 would be your diastolic blood pressure. Some symptoms of hypertension include fatigue, dizziness, confusion, swelling, vision problems, chest pain, trouble breathing, irregular heartbeat, and blood in the urine. Some serious complications related to hypertension could result in stroke, heart failure, renal failure, and arrhythmias. In hypertension, blood vessels become constricted, arteries begin to narrow, decreasing the delivery of oxygen to tissues, and increasing capillary pressure. There are two forms of hypertension, primary and secondary. The cause of primary hypertension is unknown. However, tobacco use, stress, obesity, family history of hypertension, diabetes, sedentary lifestyle, alcohol use, and advanced age are all risk factors that can contribute to primary hypertension. Secondary hypertension can be caused by brain tumor, head injuries, Cushing's syndrome, thyroid and pituitary dysfunction, and things like hormonal contraception such as birth control. Substance use, especially stimulants like cocaine or caffeine, monoamine oxidase inhibitors, and non-steroidal anti-inflammatory drugs or NSAIDs. Hypertension is treated by both lifestyle modifications and drug therapies. Lifestyle modifications include eating healthier foods that are lower in sodium, increasing physical exercise, stress reduction techniques, quitting or reducing tobacco and alcohol use, and weight loss. Medication interventions include ACE inhibitors, angiotensin receptor blockers, beta-adrenergic blockers, to name just a few common medications. Now we turn to anxiety. What is anxiety? Anxiety can develop from traumatic events, changes in neurotransmitter functioning in the brain, adverse life experiences, and from certain drugs or medications. Anxiety can manifest with symptoms such as excessive worry, increase in heart rate, and shortness of breath, to name just a few. Anxiety can spike blood pressure, which can exacerbate hypertension, further damaging the heart, blood vessels, and kidneys. Likewise, unhealthy coping techniques associated with anxiety, such as tobacco and alcohol use, can negatively contribute to hypertension as well. Stress reduction techniques, such as diaphragmatic breathing, 5-point grounding, mindfulness, and progressive muscle relaxation can help. In diaphragmatic breathing, simply take a deep breath through your nose while counting to 4. Allow your belly to extend and fill with air, as this is where your diaphragm is. Hold your breath for a count of 4, and then release slowly for a count of 4. Wait another set of 4 seconds before beginning this process again. This is also referred to as square breathing. The 5-point grounding technique involves using your 5 senses to ground yourself to the present moment and reduce stress. This is done by identifying 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste if you have food or drink available. Mindfulness is the redirection of your focus to the present moment, which can be completed through simply focusing on your breathing. Progressive muscle relaxation techniques involve the isolated flexing and releasing of your muscles, starting at your feet and working your way up to your head. Here are some additional suggestions for both stress reduction techniques as well as healthy items to eat and items to avoid when managing your hypertension. Thanks for your time in learning ways to manage and reduce both anxiety and hypertension.